I'm Dr. Ebony McKinnies, and I'm one of the neurologists here at Thibodaux Regional Neurology Clinic. Today I'm here to discuss dementia and Alzheimer's disease. So dementia is a generic general term that we use to describe symptoms related to memory loss and trouble with thinking and reasoning. So there's many different types of dementia. Some include vascular dementia, frontotemporal dementia, Lewy body dementia, and Alzheimer's disease being the most common. So when we think about dementia, it is a neurocognitive disorder where there are some difficulties with cognition. And we can see difficulties in cognition in different areas, such as memory and learning, which can lead to patients with difficulty with short-term memory issues where they repeat things in conversation a lot. There's also difficulties in social cognition, where people have difficulty recognizing individuals that they're familiar with. We also have difficulties in orientation, where patients become unfamiliar in places that are usually familiar to them. We also have difficulty in executive functioning, where you can see people with difficulty doing tasks such as balancing a checkbook. So in dementia, we see difficulties with these areas and aspects of cognition, but we see a difficulty with the decline from previous level of functioning that impairs their day-to-day activity and living. So what do you do when you suspect that a family member or a friend is experiencing symptoms of dementia? That should lead you to the clinic, the neurology clinic here at Thibodaux, where the physicians here can be very beneficial in helping make that diagnosis for your family member. So for instance, we will begin with lab work, neural images, things that can be beneficial to help us make that diagnosis. We know that some vitamin deficiencies, as well as things as depression, can also mimic dementia. So it will be very helpful for us to evaluate that for you and also do some cognitive assessments to help with the diagnosis. So when we talk about treatment options for Alzheimer's disease, we know there is no cure, but there are some things that we can do to slow the progression of this disease. There are some medications that we can use, such as donepezil, which is very common, that's helpful in boosting acetylcholine and other neurotransmitters in the brain to help make those connections and help with memory. There are other medicines such as memantine and others that we can use to help slow the effects of neurotoxins to the brain. So when we think about Alzheimer's, patients typically present with difficulties with short-term memory, but we know that this can advance to losing the ability to speak and also with difficulty swallowing and lead to bowel and bladder episodes as well. I think it's very important that we explore other options for prevention of dementia. So there are some things that we can do to help prevent this disease from becoming a part of our reality. And that includes diet and exercise. They are very important in prevention. So a proper diet is important. We want to reduce our cholesterol levels. We want to prevent hypertension. We want to combat obesity, and exercise is very important. Having patients receive 2.5 hours a week of physical exercise is very important in help preventing this disease in general. So once again, I hope this video was informative to you all. And if you do have any questions or concerns in yourself or any family members for dementia, please don't hesitate to give us a call here at Thibodaux Neurology Clinic, where we'll be happy to assist you. Thank you.